Hi, my name is Dr. Jeff Fialkov, and I'd like to talk to you about rhinoplasty surgery. There are many reasons why people are interested in rhinoplasty, and cosmetic surgery facilities such as Edelstein Cosmetic help provide patients with a safe, effective means of reshaping, resizing, or changing their noses. For some, a nose job isn't just about aesthetics, it may also be about health. Nasal injuries can cause problems, including breathing difficulties. The nose sits in the center of the face, and if there's something wrong with the size or shape of it, people will easily notice. Cosmetic rhinoplasty can make the nose more appealing and proportionate to the rest of the face. A skilled cosmetic surgeon can potentially change any visible feature of the nose. He can change the size, the length, tip size, definition, the prominence, nostril width, can remove bumps, and we can even change the shape of the nose that results from birth defects and problems caused by injuries. When a deviated septum is repaired, breathing through the nose can be made a lot easier. There are different types of rhinoplasties, including closed rhinoplasty, which is a technique that involves making internal incisions to adjust the structure. When an additional incision is required in the tissue between the nostrils, we refer to the technique as an open rhinoplasty. The nose job can also be categorized as primary or secondary. The former is when no nasal surgery or trauma has affected the area, while the latter refers to a nose that has undergone either operations in the past or trauma. We can also perform just a septoplasty, performed when the septum is deviated or shifted. This technique corrects the functional form of the nose and allows for proper airflow. It's not really done for any aesthetic reasons. Now, if you're interested in a nose job, then you need to make sure that you are a good candidate for the surgery. First, you've got to speak to an experienced surgeon. And in general, the ideal candidate is at least 18 years of age and has realistic expectations. It's important to be in good overall health so that you can undergo the procedure safely. If you're unhappy with the size, shape, or contour of your nose, or have nasal breathing problems, you may very well benefit from rhinoplasty. All surgery has potential risks, including cosmetic surgery and rhinoplasty. However, the risks can be minimized a great deal if a skilled, experienced surgeon is performing the procedure. When done correctly, rhinoplasty is relatively safe. There are still potential complications, such as excessive bleeding, adverse reactions to the anesthetic, and infection. There's also a risk of the outcome of the surgery not being exactly as expected by you, the patient. And for this reason, a lengthy discussion with your rhinoplasty surgeon before surgery is absolutely critical. During that discussion, the patient's expectations and the surgeon's ability to deliver these expectations should match. If not, the patient may not be a good candidate, or the surgeon may not be the right rhinoplasty surgeon for you, the patient. Now let's talk about recovery from rhinoplasty. For the first week after surgery, you'll be required to wear a nasal splint. You may experience moderate bruising and swelling around the eyes. It's best to avoid any strenuous activities. Your doctor will let you know when it's safe to resume those activities. You may have difficulty breathing for a few weeks due to the swelling. Once the swelling goes down, results will become more noticeable. Your nose will become more refined over several weeks and months. Thanks for watching.